I invite them to explore and keep an open mind. And I think it's that open door policy to offering chronic pain patients that opportunity to move forward in their own time, in their own way, and exploring things that might work for themselves. That's an exciting field of practice.
I'm Michael Max, and this is Geological, the podcast that curates East Asian medicine and methods through the power of conversation. Our world is polarized, and while that's something often complained about, it's also part of the natural order of things. The Tao, after all, divides undifferentiated being into yin and yang, and then, well, there you have it, opposite poles, complementary aspects that both reflect a greater unity. As humans here in the domain of Earth, we tend to lean toward one side of that unity or the other, and in doing so, miss the wholeness and double down on why our side of the spectrum is right, more true, or the way to a better future. The dance of differences is what allows us to be helpful to our patients. For example, in clinic, we know that dampness benefits from dryness, just as dryness is resolved with more moisture. Those who are detail-oriented and have a predilection for controlling others could benefit from a more laissez-faire attitude, while those who are careless and unable to consider others would do better with increased ability to see how their actions affect the people around them. I want to share with you some insights I've gleaned from these past couple of years studying and practicing Saam acupuncture. Maybe this will be helpful to you in your clinical work. In the Saam tradition, those with an excessive sanjiao tend to be meticulous and detail-oriented. There is a proper way to do things, and things should be done that way. The Shaoyang fire in these folks is driven to control others. There's a right way, damn it, and they're here to make sure it gets done. These people are sensitive and critical, and they'll let you know when you're on the wrong side of what's right. There's an attractive lightness about those with excessive sanjiao energy. They see well in the dark and have a notable brightness that emulates from the eyes. Contrast this with the counterbalance of Dre-yin wood, the liver. These people with excessive yin wood are not attentive to the outer world, as they're cocooned in their own experience. Compared to the sanjiao type, they have more a sense of live and let live, and so they've no interest in controlling others. They tend to be a bit socially clumsy and easily accused of being rude, but it's not that they have ill intent or mean to offend. They're just a bit clueless in the social realm. Being rich in Dre-yin blood, they're dense. Imagine the feel of a Lord of the Rings dwarf. They have that kind of solidity. They're like turtles, slow and shielded, whereas the sanjiao excess is like a border collie, quick, sharp, and with an agenda in service of order. It's not that any particular trait or talent is good or bad, simply useful or not in any particular moment, much as a hearty stew arises from its tapestry of flavors. Our work in clinic is to give what's needed in any particular moment. The virtues of the 5 phases, the counterbalancing climates of the 6 qi, the places where some nurturance is called for, and those where cutting away that which is excess and obstructing will restore the flow. It's helpful to remember that there's a place for it all. The knack is to know is what needed and in what amount. Pain is unavoidable. It's a signal that demands we pay attention. It serves a purpose, but for some, that signal is set to always on. It affects not only the person with the pain, but those that they're connected to as well. When it's children that have chronic pain, for sure, that will affect the family. And the pain can take on a life and a character of its own. Our guest today on Geological is Jonathan Riemer. He's been working with and researching chronic pain in children. There's a lot more to it beyond the usual Chinese medicine idea of blood stasis. We'll be discussing chronic pain and approaches to working with children, family relations, polyvagal theory, and more. Stay with us. These conversations come to you through the generous support of our sponsors and members. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. It's Women's Health Month at Mayway Herbs. Check out the new website for learning resources on helping women with herbal medicine. Are you a creature of habit? How about making a change that helps your patients and the planet with AccuFast needles? And later in the show, raising your fees doesn't have to be a difficult process. Jane has helpful suggestions on making it easy and effective. And finally, have you considered that having a thriving, profitable practice is one of the most healing things that you can do? Julie Bear Don't Walk has, and she can help you do something about it too. Do be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more.
Hi folks, I'm Yvonne Lyle, president of Mayway Herbs. May is Women's Health Month, and as a women-owned and women-run business, we especially love how Chinese medicine can support wellness through every stage of a woman's life. So in this month's newsletter and podcast, we're covering topics like PMS, pregnancy, menopause, and osteoporosis. We'll share expert insights and effective treatment strategies you can put to good use in your clinic. Our Plumflower brand line includes herbal tea pills, tablets, extract granules, and organic herbs, all of which you can find on Mayway.com, and where you can also find articles, videos, and other resources to support your practice. Since 1969, Mayway has been a trusted source for high-quality herbal products. In these challenging times, please know that we remain committed to keeping our products accessible and affordable so you can take care of yourself and your patients. As always, thank you for supporting Real Chinese Medicine.
Daily habits and routines feel comforting, familiar, easy, automatic. That's the power of repetition. You've worked out the kinks and can do it with your eyes closed. But what if you shook things up? What if you ditched the old routine and tried something new? Hi, I'm John Sten. I've practiced acupuncture for over 30 years, and together with my wife Kelly, we created the world's first eco-friendly acupuncture needle. The AccuFast earth-friendly needle system cuts your packaging waste by 60 to 90%, depending upon your needle type, speeds up your needling, gives you more control, and best of all, while you're healing patients, we plant a tree for every 2 boxes your clinic uses. Thousands of acupuncturists have already made the switch. In just the last year, they've helped plant over 16,000 trees. Since we started, that number has grown to over 50,000. So break the routine. Be the change. Visit AccuFastNeedles.com. Your patients and the planet will thank you.
Jonathan Riemer, welcome to Qiological.
Thank you, Michael. Thanks for inviting me and letting me speak today.
Well, actually, you kind of invited yourself in a way.
I did indeed. I did.
And I always appreciate that. Sometimes people have something and they go, I got this thing I'm doing, and I don't know if you know about it, but I'd like to share it. It's one of the things I appreciate about the podcast. Sometimes there's people that I meet through the podcast, and And then it's people like you that I meet because you reach out. You're doing work with pediatrics.
Yeah, so currently working with the rheumatology team in Royal Manchester Children's Hospital in Manchester, England, in the UK. And as part of the rheumatology team, not only do we see the inflammatory conditions, but we also see a lot of chronic pain, and we treat chronic pain.
It's kind of weird thinking about children with chronic pain. When I think about chronic pain, I usually think about older people that are a little bit broken down. It's hard to imagine with kids in some ways. Tell me more about it.
I think this is the interesting side of it, because I think when you look at the evidence around chronic pain and what we all accept in regard to chronic pain is that we accept that potentially we have this pain amplification, terms such as allodynia. We talk about sympathetic nervous system upregulation in chronic pain. And I think what's really interesting about it is my interest in regard to my research around acupuncture and use of acupuncture in chronic pain in pediatrics, I suppose recognises that there is a framework existing in classical Chinese medicine that already recognises this imbalance, that we've got the sympathetic and the parasympathetic nervous system that is part of that homeostatic mechanism. And in chronic pain, certainly we know is that mechanism goes wrong, whether it's from an initial trauma, or I like to use the term allostatic load, which is that sense of so much external pressure on an individual that it causes that dysfunction, causes that imbalance. And I think certainly from the acupuncture point of view, I think we've got lots of evidence in the role of acupuncture, not only from an evidence-based medicine point of view, but from classical Chinese medicine, about regulating that and creating that harmony and balance. I think we all recognise, the kind of the classical diagram of yin and the yang, and the flow of qi and the disruption of the flow of qi in sort of classical medical texts, and how that, I think, chronic pain offers an opportunity for us to understand how those sort of classical texts and those classical understanding of pain in Chinese medicine can have an appropriate answer to chronic pain, certainly not only in pediatrics but also in adults.
Yes. It is always fascinating to me when there's something that shows up on the Western medicine side. We look at it and go, oh, yeah, that actually rhymes with something that Chinese medicine talked about hundreds or thousands of years ago. Recently, there was this, air quotes, discovery of this incredible layer of tissue called the interstitium. It's this fluid-filled layer in the body that connects everything together. It's kind of like fascia, but it's full of fluid, and fluid flows all the way through it. And, you listen to them describe the interstitium, and you go, well, that's the triple burner. Pathway of fluid, yin, qi, on and on and on. They couldn't find it because previously they'd been dissecting more desiccated bodies or preserved bodies. You need to have fluid in the interstitium to see it, to find it. It's both function and form. It's got both of them, but there it is. I'm just a little bit familiar with this idea of the nervous system getting dysregulated. So maybe there's been an injury or something, and the body's actually cleared it, but the nervous system thinks something's still going on. I think you're referring to this. It sounds like you found some correlates in our Chinese medicine world in ways of treating it. So I'd like to hear a bit more about that, especially as I just got a new patient scheduled for next week. I'm not kidding you. It's funny how these things work. And it's just, the kid's like a teenager and basically in pretty good health, had, ask about previous injuries. Well, they fell on their sacrum once, but that was a long time ago, and that's fine. And then some time later, this pain shows up, and everybody is confused in the Western medical system. She's been through all the scans. They've looked in her blood for rheumatoid factors. It's like we can't find anything. So here, eat this gabapentin in the meantime.
Yeah, and I think that's the interesting thing is I think despite what we know so far about chronic pain and also, I guess, some of the developments. So it's interesting in my research I've touched upon the development of battlefield acupuncture, so the auricular therapy. You know, when you look at the auricular therapy points, they are addressing multifactorial components of pain. So, like, one of the points is very much focused on harmonizing and balancing the emotional side. If you look at the definition of chronic pain from the World Health Organization, and you look at the definition of pain from the International Association for the Study of Pain, we know that pain is multifactorial. We know that it contains, all the domains of health. And this is what's I find really exciting about chronic pain and the treatment of chronic pain is that actually your approach needs to address these multifactorial components of pain. So whilst we can talk about the comparatives between, I suppose, ideas and models of sympathetic and parasympathetic nervous system, we also have to be aware that there are these multifactorial components of pain that we also need to address. So rather than going down a very strong pathway of, I suppose, from a classical Chinese medical point of view of restoring the flow of qi or addressing imbalances between yin and yang, which you comparatively compare to the autonomic nervous system and that homeostatic mechanism, you also have to be aware and understand those elements of different domains of health, such as psychosocial and emotional health, and also what classical Chinese medicine is always trying to point us towards is this idea that the macrocosm and the microcosm, that we have to also address the environmental causes of imbalances and disharmony. So I think in the way that we currently treat children for pediatric chronic pain is that we, in therapies, not only do we do the physical therapy, so the physiotherapy, but we use a lot of psychotherapy, and occupational therapists are involved in that. And we try and sort of stay away from the pharmaceutical side of things.
Well, here in the States, we love our pharmaceuticals.
Yeah, and I think that's the development, isn't it? I think that's the battlefield acupuncture was the first thing that kind of started to address this issue around the pharmaceutical approaches to pain. But I think also, we're still very much not able to separate acute pain from chronic pain. So we know pharmacy is very good. And even in classical Chinese medical texts, the herbal medicine side of pain management, pharmacy is very good for acute pain. It gives you that sort of break from the pain that allows your body to recover and get over the pain. But when you've got the chronicity of pain, it's something very different. And we see it ourselves. We still see it ourselves.
It's a different thing.
It's a very different animal.
Yes. I want to get into the battle. Well, actually, tell us a little bit about the battlefield at this point, how this fits into the picture. I don't know much about it. I've heard about it. I've looked at the points. Some of them are points I recognize. Some of them are points that are areas or tissues in the brain and very focused on that. And the other thing I'm curious about, when I've seen the battlefield acupuncture done, they've got these like darts or studs.
That's right, yeah.
That are almost like staples that go into the ear. And so I've got some questions about it. It's like, do you have to do that? Are there other ways to stimulate those points? Because, I don't know about other acupuncturists, but I know for me, at times I put a point in and it's like, oop, that's not the right point. And taking out one of those does not look like a walk in the park.
So it's interesting comparatively. There is a lot of research around auricular stimulation in functional pain. Again, this is a different category of pain that we, I suppose, deal with. It's something that we don't approach from our team as such at Royal Manchester Children's Hospital. It's very much comes under neurosciences and neurology, but the functional pain and I guess the functional, I suppose, diseases, in terms of things like functional epilepsy or other things very similar to that. There's a lot of evidence around the use of auricular stimulation. And I think potentially the evidence is around this idea of vagal nerve stimulation. Comparative studies where they've looked at autonomic dysfunction in functional pain. So by using the battlefield acupuncture in auricular therapy or auricular acupuncture delivery, what you're essentially doing is you are delivering a treatment that is auricular stimulation to the vagal nerve and modifying the autonomic nervous system through that direct route, through the ear. It can be very powerful. I think what's interesting is auricular therapy and certainly how it's evolved alongside, I suppose, developments like battlefield acupuncture, where using very specific points to modify the autonomic nervous system, and therefore you're addressing this imbalance between sympathetic and parasympathetic nervous system. In terms of using it in a pediatric setting, obviously kind of the idea of putting studs in children's ears, and also the care of it, in terms of what children do with their ears, I think has to be considered in that picture. I think probably isn't appropriate. However, I don't think that should exclude the fact that potentially auricular stimulation or auricular acupuncture, and the choice of auricular acupuncture from more choice of points through Chinese medical auricular acupuncture, I don't think that should be excluded at all. I think actually the acceptance of auricular acupuncture in a pediatric setting might be more preferable than using other point selection.
Absolutely. That makes complete sense to me. Now, when you're dealing with kids, look, sometimes kids don't need a whole lot of stimulation to get their systems to change. Do you use needles with them? Do you use ear seeds? Do you maybe sometimes use some electric? What kind of stimulation do you find helpful? I suspect maybe you've done some research on that.
Anecdotally, I think from my experience, because of our approaches with chronic pain, what we do currently in and which is a very evidence-based approach, is that we look at strategies. So we try and encourage acceptance and self-management for chronic pain in pediatrics. So, for example, we do the physical therapies where we're encouraging exercise and movement. We are using occupational therapies to kind of look at how we can modify activities of daily living that can help children cope with the chronic pain, including support for sleep hygiene. We provide psychotherapy, which is very much around the idea of acceptance. So I think for that model to continue as our evidence-based standard treatment and have acupuncture fit into that, I think ear seeds is a very good idea, because what you can do is you can put the ear seeds in place for auricular stimulation, and then you can build that into that self-management program where they are self-stimulating and it's safe. We're not using anything that's invasive, so it's very non-invasive, and I think also acceptance. So while we're asking them to accept their chronic pain, we also want them to accept the treatment as well, and I think that is quite powerful.
This episode is brought to you by Jane, the clinic management software that honestly just makes running a practice easier. Let's dive into something that's never easy, but sometimes necessary: raising your fees. It can feel awkward, right? But here's a tip that can really help. Consider offering flexibility to your patients as you introduce the change. When patients face new fees, it's natural for them to feel uncertain or concerned. That's where flexibility can really make a difference. Offering options like a phased increase, suggesting a payment plan, or even taking a moment to talk things through can help to ease the transition. These thoughtful gestures show your patients that you're listening and care about them, which strengthens the trust you've worked so hard to build. If you're looking for more ideas on how to navigate these kinds of changes, head to frontdesk.jane.app and check out the article, How to Tell Clients You're Raising Your Fees. One last thing, if you're ready to give Jane a try, you can use the code CHEOLOGICAL for a 1-month grace period on your new Jane account. I want to come back to this acceptance piece, and I'm curious about the psychosocial factors as well. I'm sticking a pin in it right now so we can come back to it. But before we get to that, I've heard you use some different phrases about different kinds of pain, sympathetic, parasympathetic, functional pain. I think it's the first time I've heard that term, functional pain. Thinking to myself, what is there functional about pain? That sounds like dysfunction. But I think that means something. Could you just, for those of us who don't understand the kind of framework that you might be using with your research and your work at the hospital, the way you guys are thinking about pain, just like a quick introduction to the kinds of pain that children present with and how you guys think about it, both from the Western side, neurology-based, that whole thing, and from the Chinese side. I know it's a small question, but there you have it.
I think I'll start off with functional pain because I think that's probably the biggest mystery to most people. But I always kind of use the idea that it's probably the first thing that we learn in terms of pain. It's that situation where we're not saying that there's no pain. I think this is where the confusion lies. I think because of the sort of evidence-based, the rational approach, the biomedical model can be very much dismissed as real pain. So we're not in any sense saying that there is no pain. But what we accept with functional pain is this disconnect between parts of our self. So, when we talk about, Cartesian duality, about mind-body split, I think functional pain is probably a representative of that, is there is this disconnect between our physical self and our sense of physical self and our much more, I suppose, psychological, mental self. And it's through this disconnect that we have this dysfunction where potentially pain becomes a way of communicating that disharmony. Now, that sounds very ambiguous and it sounds very abstract. But what I want to do is take people back to the idea that those first experiences of stomachache when we're a child and we get the day off school. And when we get the day off school, we make that connection between that sort of physical sense of stomachache or stomach pain and not having to go into school. So actually, potentially, that is our first experience of functional pain. And it's not that we haven't got stomachache, and it's not that we want the day off school, but then maybe on future episodes of stomach pain, there isn't an organic cause, but the biggest driver is the psychological, that we don't want to go into school, and therefore we get a manifestation of pain.
Because we know that our stomach pain in the past has given us a day off of school. I don't want to go to school for whatever reason. I'm having trouble with somebody there, or there's a test, or I'm just anxious, or whatever. And so, stomach pain keeps me out of school. At least it has in the past. And my suspicion is, if that happens a number of times, that groove gets deepened. There's the function and the dysfunction in a sense.
I don't think it's a conscious thing that happens or occurs. I think it's that process. If we're looking at it from a neurological perspective, I think those neural pathways have been developed, and it's the triggering of those neural pathways by other areas of our brain, maybe our limbic system, our emotional side and our experience of pain that then manifests pain in a physical sense. So with these types of patients, we're never saying to them, we don't believe that you're in pain, but we understand your pain to be very much not an organic cause. And I think it's very interesting, certainly, and I don't want to kind of dwell too much about functional pain because obviously, there's other types of pain to kind of discuss. But from a functional pain perspective, I think it's very interesting that the expectation from patients and families is that there is an organic cause. And this is where there is this kind of almost a Venn diagram and crossover with chronic pain, but also, like I say, the International Association of the Study of Pain recognises that these factors do also occur in acute pain, but are easily managed through pharmacy and medications more. All that does is basically upregulate your sympathetic nervous system. It kind of putting you into that sort of fight, fright, or sometimes, that flight situation where you're very switched on, you're very reactive, you're very defensive. And we know that pain is there to protect us. If we bang our elbow and our elbow's injured, we move it, it's painful, so we don't move it until it gets better. And then maybe the next day we try moving it and it feels a little bit better. But maybe when we take it to the end of its range, it's painful, so we don't take it to the end of range because, it allows us to heal. So pain is a very, very important process of healing in our bodies. And I think from that perspective, we've embodied that idea of what pain is, that we're always constantly looking for a physiological cause. So it's very, very interesting how there is this overlay.
Yeah, I don't mean to suggest that we consciously, I got a stomach ache, the stomach ache keeps me out of school. I think my point is more toward our physicality, our psychology, our spirit, our mental experience, mind, body, for lack of a better word. I hate that. But it's so entangled that our emotionality is completely entangled with her physicality. And so if something happens there emotionally, especially unconsciously, and it tangles in with the body, now you've got the pain. Well, we can't find an organic cause unless you consider that our emotionality is part of our organic being, in a sense.
I think this is innately some of the problem that we have, is that it's not something that we learn. We don't learn that our being, our wholeness, our complete self is not just the physicality, but it's multi-layered. And certainly even from neurological pathways that are involved in pain, we know that different areas of the brain that are processing, memory, emotion, they all play a part, not just in functional, not just in chronic pain, but also in acute pain. So I think what we have to understand is that pain is there to protect us. And I think starting from that base point is, how do we modify that response? And this is quite interesting in terms of the inflammatory patients I see, not the pain patients, but the inflammatory patients I see, is actually we do very well at modifying that immune response in rheumatology, 50% pharmaceutically and 50% using physical therapies. And we manage their, I suppose, rheumatological disease through that modification of the defense mechanism and that immune system. And comparatively, it's a similar approach really with pain, that, what we want to try and do is modulate that defense system, that pain is there to try and protect us, to allow us to heal. And I think when we get into areas of chronicity, something has already got stuck or has gone wrong, that we then have to approach it in a very different way.
So what are you finding can be done with acupuncture? We just spoke a few minutes ago about the battlefield acupuncture seems to be helpful. Auricular therapy sounds to be useful. Sounds like it's very useful. How else are you using and bringing acupuncture into this? And I'm especially curious about the studies that you've done and how those are structured.
So I think the starting point is that idea of acceptance. So in terms of bringing acupuncture in, I think what we find with the current therapy approaches that we're using for treating pain, the non-pharmaceutical approaches that we're using with physical therapies and occupational therapy and psychotherapy, is that we have to have acceptance. That acceptance and that engagement of their diagnosis is very important for them to start that journey to rehabilitation, that journey to management and living and accepting pain.
So when you say acceptance, hang on, I just have to dig into this for a moment. In this context, what does acceptance mean?
So I think, to me, I think this goes, and different people will have a different opinion about this, I'm sure. I think if you go back to the model of disharmony and you go back to the idea of pain amplification or sympathetic upregulation in chronicity of pain, that what you want to try and do is you want to try and balance the sides out. And I think, again, this is, it's classical Chinese medical theory. It's there in the classical Chinese medicine texts about, restoring the flow, restoring the balance. But from our perspective, we have to use different terms. We have to use the idea of the autonomic nervous system. And acceptance, what acceptance? It is.
Which is a really helpful model, isn't it? Because, look, I love our Chinese medicine ideas and our theories and things. But from my Western mind, there's something very unsatisfying about, well, we're just moving the qi and that will create the flow. And I'm thinking, yeah, and there's a side of my mind that wants more. I get it. I'm good with creating the flow. I know what it feels like to be in flow. Things are great. But the specifics, I think that they matter. And so when I hear you talk about autonomic nervous system, when I hear that there's influence of the vagus nerve, these things seem like something that's tangible, useful, and actionable from both the Western and Eastern side. Plus, look, we talk to our patients about, I'm going to create balance, and our patients rightly deserve to roll their eyes at us because we didn't say anything that makes any sense to them. But talk about your autonomic nervous system in a way that we can have one foot deeply in Chinese medicine, the other deeply in Western medicine, and really, I think, have the capacity to communicate something. So, yeah, tell me more about the autonomic nervous system. I'm curious.
So going back to the idea of acceptance, and I think from my experience, that acceptance is a key point. And we have patients sometimes coming into sessions and they have doubt. They have embodied angst about the diagnosis of chronic pain, primary chronic pain. That the diagnosis is pain itself. There's nothing causing it. There's nothing behind it. There's nothing that we need to kind of do any further investigation to rule out. So acceptance is the starting point. Now, for one approach, and I think one way we can integrate that with acupuncture is that acceptance in itself is that decompression. It's that downregulation of that sympathetic nervous system. So they're not worrying, they're not concerned, and they're not looking for other sources of their pain. They have got to a point where they accept they've still got pain, they're still experiencing pain, it's still very dysfunctional, it's still having a massive impact on their activities of daily living. Well, that acceptance in itself is starting to lower that sympathetic nervous system. And I think that's when we start to deliver the strategies that we currently provide from our standardized treatment. And I think that's where we can also use, I think if I said acupuncture was an adjunct in this state, it would probably downplay the role of acupuncture. And I don't want to downplay the role of acupuncture. I think it's more that it becomes an enhancement of what we deliver. So one of the things that we deliver, not only just the physical therapy of using movement and helping to downregulate the sympathetic nervous system through movement, through exercise, but using, I use a lot of breath work in my practice. So using the sympathetic downregulation, using breath control. And at the same time, we can use point selection that also has a positive effect on the parasympathetic nervous system. So we might use heart meridian points. So something like heart 7 might be a useful point that kind of helps to bring into balance that parasympathetic side that is very much about relax, rest, everything's fine. It's like that cozy blanket, that comfort zone that we can use as point selection for alongside that. So I think some people might say acupuncture as an adjunct, but actually it's an enhancement of what you're already delivering. I think also, when we're looking at the benefits and the evidence base around movement therapies, so exercise, and I find this particularly interesting in terms of your chronic regional pain syndromes, where you've got a lower limb is someone's experienced allodynia in the lower limb, they experience dysfunction or inability to move the joints. I think you could reasonably use acupuncture to use meridians in the lower limb, even on the opposite leg, because there's that comparison with the nerve roots that go into the spine that also is shared with the leg that is affected by chronic regional pain. So actually you could be doing movement therapy with the affected leg at the same time as you applying it or using point selection on the other leg, giving that almost that stimulation to the same nerve root.
Yes, this thing about acceptance, I think it's not just with children and chronic pain. I think of many adults who come into my practice. You probably have them, well, I don't know how many adults you see, but, folks listening, there's the folks that come in and they don't know what it is. They're looking for a diagnosis. They just want a diagnosis. Sometimes I've actually had people say to me, I don't care if it's cancer. I just want to know what's going on, which is a weird thing to hear.
That's very true.
Yeah, it is true. And hearing you talk about acceptance, I realize that this is something I can really take into my practice. And give people the possibility that you don't know, we don't know, and you might not know. It might actually not be knowable, but that doesn't mean we can't actually do something about your experience of it.
That's a really interesting point, Michael, because hearing you say that excites me, because one of the things that I often say in this patient cohort is keep an open mind. It's not necessarily what you choose to do, it's what works. And that's where we provide multiple strategies for them. Some of the treatments involve desensitization. And we have a very, very standard pack of an assortment or a toolbox for desensitization that we give to patients and parents. And we ask them, we invite them. I always invite, I don't tell them, I don't suggest this is what you need to do. I invite them to explore and keep an open mind. And I think it's that open door policy to offering chronic pain patients that opportunity to move forward in their own time, in their own way, and exploring things that might work for themselves. That's an exciting field of practice.
I would agree with you. There are so many times I find myself in clinic, patients are kicking out this idea that maybe it's this, maybe it's that. It's like, well, why don't you explore one of those? Like, do it for a month. Like, be your own N of one study. Do an experiment. Like, okay, you think you have trouble with dairy. Okay, maybe, I don't know. Why not just give it up for a month? As an experiment. Not forever. As an experiment. See what happens. That's a really different thing than, well, you're lactose intolerant and you should do an elimination diet and, blah, 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 blah. It's like, do an experiment. Who doesn't like to be playful and experiment with things? I think we all have kind of an inner child aspect that when invited to engage like that, you could take something as arduous as changing your diet, but, well, if it's a playful experiment, that's a whole different thing, isn't it? That opens up that open-mindedness that you were just talking about.
I think also as well, in my mind, and I'm not saying it's the same for everyone, but by giving people that invite, by encourage them to explore, I think you're also creating that safe space. And I think once you create that safe space, everything's on the table, or anything can be on the table, that you're also, if we're going to have to go back to kind of the neurology of pain, we are also down-regulating the sympathetic nervous system.
Tell me more about the safe space and bringing that into the treatment.
I suppose this comes back to also what you touched on before about the role of parents. I think we didn't get into a conversation about that, but we touched upon, I suppose, that component, parents' role in chronic pain patients. And I think what we have to do is we have to also address and create that space through making sure that parents have that level of understanding as well, and parents have acceptance. So we do, part of our standard treatment, we run a program which is about understanding and accepting pain, but living with it, and parents are involved in that. So we want to also make sure that parents are on board with acceptance as well. And I think it's about making sure that parent-child relationship is a relationship of support and understanding as well. So I think that's probably some of the steps we do to deliver that space.
Having a thriving, profitable practice is one of the most healing things you can do as a healthcare practitioner. Because a robust business is the ultimate expression of vital chi, and that's the heart of our medicine. I'm Julie Bairdontlock, and I help practitioners grow nourishing, profitable, authentic businesses that embody the generative cycle of Chinese medicine. This isn't about all yang all the time. It's about expanding your own internal capacity, growing collaborative relationships with your patients for ethical patient retention, and marketing as an extension of this medicine, not a necessary evil. You already know that everything is connected in your patients' lives and bodies. The same is true for your business. When we align your systems, your schedule, your pricing, and your offerings with you, we create flow, which means more spaciousness, more impact, and more joy. When you are in the flow, fully resourced in terms of chi, time, and money, your business becomes a source of healing, not just for your patients, but for you. Let's grow something rooted, radiant, and real. Visit lifeflowconsulting.com to learn more.
I'm glad you bring it up. That sounds like an important component. I hadn't thought about it till I heard you say it, and I hear you say it, and I go, well, yeah, of course you want to get the parents on board. Again, I mentioned I recently had somebody schedule to bring their child in. One of the things that I noticed in that conversation of getting them scheduled is, wow, this parent is really pissed off. This parent is really angry about what's going on, how they've been treated. It doesn't make sense. It's not fair. I've seen this before. Sometimes I've seen it more with more elderly people where one's being the caregiver for the other one and bringing them in for treatment. And I look at that caregiver and it's like, oh man, you need some help. And often what I would do is while the person who's being brought in for treatment is getting treated, I'll take that caregiver and it's like, why don't you just lay down here and let me put a few needles in your ear? Because that person really needs some support.
That's a very exciting premise. That I think that's something we've not considered. I think a lot of what we're currently offering for parents is very much around the psychosocial, but actually, I think you've got a very valid point. I think why not also offer the shared experience of acupuncture, and you kind of bridging bridging that experience between parent and child. And maybe the point selection that you use for parents, it might be something very different, but the shared experience is one of unification and creating understanding.
I love it. Again, I'm so glad we're having this conversation. It's germane to someone I'll be seeing soon. The shared experience. Look, they're already having a shared experience of difficulty and dysfunction and everything that goes with having, your child not be well. Bringing in the shared experience of the acupuncture. Yeah, I'm curious about that. It'd be fun to do some studies on it. But as a clinician, I'm thinking, well, that's an easy N of 1 study that I can do in my clinic and just see what happens.
I think it would be an exciting prospect to look at the impact of that. I think that's definitely future. I'm gonna steal that idea. I think that's going to be a future research idea, because I think we do the combined psychosocial, we do the psychosocial therapy with parents, and we do some of the education with parents, and we do combined parent and child therapy as well as separate therapies for parent. But we haven't at this point considered acupuncture for parents, and I think I like the idea of that. I really do. I think what we do find, and I think it's, again, this is more sort of anecdotal from clinic experience, is that we do find that we do get resistance from parents, and the impact of that, I suppose, progress with the child. I think we haven't yet fully understood that. We haven't fully understood that potentially, we can have regression with acceptance, because what parents are going through, our focus is always, is although we include parents, and although often we sort of talk about treating families and not patients, that our focus is still on the pediatric patient. And actually, whilst we have that approach that helps create that supportive environment and that team around the child, we don't actually think as much around treating what the parents are going through. And it's interesting that it's the parents that are the ones that are on that journey with that child. And it's sometimes if these patients are coming into an acute setting and they get admitted and they go through all the investigations to rule out potentially organic cause, and whilst we don't necessarily think it's necessarily functional, but it has got some, I suppose, organic origin in the sense of chronicity of pain, that parents can get upset and can get quite agitated by the idea of a diagnosis of pain, and that there's no other causes, and pain itself is the diagnosis, and we do get that experiences, but we also get that regression along that journey. And we often probably assume that it's an amalgam of patient and parent that is regressing with that acceptance, but actually, do we fully understand the actual parent component? And actually, if we treat that parent, maybe we can counteract that.
It's a great question. One of the things I love about practicing medicine is you get lots of great questions. Sometimes you get answers, but you sure get great questions. And think about like family systems therapy. They'll bring in, like this troublesome kid, right? The identified patient. Well, maybe there's other stuff going on in the family. That kid just happens to be sensitive to it, or they're the ones that are keeping the lid on a troublesome situation. As the system changes, often the identified patient, whatever issue they have, will change as well. That whole family systems thing is absolutely fascinating, and it really makes us consider the whole psychosocial aspect of the kind of creatures that we are. I think this directly comes back to our neurology in some ways. I don't know a whole lot about polyvagal theory other than I've talked to a few people, I've read a few books. I'd love to get your thoughts on the whole polyvagal idea. It seems to me, working hypothesis on my part, okay, because I'm no expert, But it seems that the vagus nerve and its various pathways to the different organs and viscera, the way it connects us in profound ways, both physically and psychoemotively, it just might be the antenna that makes us the intensely social creatures that we are.
What I'm thinking now from you saying that, Michael, is this idea that one of our strategies, one of our approaches with chronic pain is we touch upon circadian rhythm. So we talk about diurnal patterns and how we could modify them to get better patient outcomes. We have these, in age-appropriate language, we have these discussions with our patients, and we talk about routines and we talk about modification of routines. But actually, when you talk about the idea of this polyvagal theory, that actually we live in units, don't we? We live in these social units, and, call them families, call them social networks, peer groups, and I suppose how these have an impact on patients with chronic pain is important, and that's why we talk about circadian rhythms and routines and strategies to manage our routines and our, we use things like pacing to talk about how patients can, manage their energy levels or kind of become more in tune with that more, I suppose, that macrocosm of rhythm that embedded in the bodies are operating in. So I think it's very important to kind of think about, I suppose, the impact of those systems and those routines and how that relates to autonomic, I suppose, homeostasis.
I hadn't thought about that until you mentioned it. And I'm glad you did, because it makes a lot of sense. Look, there's lots of ways of intervening. And sometimes it's with a needle. Sometimes it's with food. Sometimes it's with medication or herbs. Sometimes if you can just break some seemingly innocuous habit, the system changes.
It's about changing the system.
We don't always know what the biggest lever is going to be. Yeah, it's about changing the systems. It sounds like a fair amount of that goes into your research. You're not just looking at an individual with their neurology and all that. It's like you're also bringing maybe even social influences. You used the term earlier in the conversation that there could be issues with, and I love this term, not that I want to have it, it like rings true. You said embodied angst.
I think when I'm talking about this embodied angst, potentially it's this disconnect. It's going back to this disconnect between components of ourself, the physicality of ourself, and the mental and the emotional and other aspects of ourself, which we know we've got lots of different cultural terms for. From a Chinese medicine point of view, we can talk about different aspects of a person that represents that, but it's that disconnect, is that embodied angst, that the physical sense of being is in doubt. And I think potentially we're at risk of this with this idea of, and again, I go back to this quite a bit with the idea of this allostatic load, that our operating systems, that is our complete self, is struggling with what we're putting on it and the overstimulation. A lot of our patients that we see with chronic pain, a significant number have sensory processing disorders. They've got a diagnosis of autistic spectrum disorders, or they've been misdiagnosed or not diagnosed. So when their operating system is effectively centrally overloaded or stimulated, and this allostatic load, there is this kind of embodied disconnect.
And that's a way of dealing with, or I should say disconnecting from the discomfort of that heavier load that's on the nervous system. Do I have that right?
Yeah, I think potentially you've got a couple of things going on. I think potentially, and this is highly theoretical and my opinion more than anything else. I think potentially you've got the defense mechanism of pain, like the alarm system of pain, And then that is a trigger to the, again, making reference to sympathetic nervous system, that's the trigger to sympathetic upregulation. But at the same time, you've got this disconnect that in itself creates a state of unrest and a state of disharmony, which just then is almost like the fuel that drives the engine of pain.
Well, we talk in Chinese medicine about externally generated problems and internally generated problems. It sounds like an internally generated problem.
Yeah, very much so. And I think this is where I guess some people listening to this might make the connection between this idea of flow. I think very, very, very early on, Michael, you talked about this idea of, restoring the flow or restoring the movement of qi. And actually, I think that's where that internal process is halted or interrupted or disrupted that then causes that disconnect.
How long have you been doing this investigation with pediatric pain now?
I mean, going back to my own history, I started off in anthropology. I'd always had an interest in through anthropology the idea of illness in society and the role of illness, how actually illness is quite functional. Going back to functional pain, illness can be quite functional for societies or for systems, and actually it gives us that opportunity to address some of the, I suppose, what we're talking about in terms of Chinese medicine, those external factors that create disharmony and cause internal disconnect. So I was always very interested in that, and I had the opportunity to kind of towards the end of my degree to do some stuff with the Wellcome Trust. Was Manchester University had a study group that was around Chinese medicine. So that got me really interested in Chinese medicine. When we're going back, we're talking about the 90s here. So I was very interested in Chinese medicine, and I just wanted to learn more about it. And I'd already previously been exposed to the idea of qi through qigong practice and tai chi practice. So these things sort of started to kind of sort of fit into place. I have this very opinion of my own journey through this is very things just to fall. If I just leave it, things will just fall into place. So yeah, so from anthropology, I was very interested in Chinese medicine, and I only got into physiotherapy because I think at the time I remember after doing my anthropology degree and doing some studies with various individuals and doing various further practical studies around Chinese medicine and Korean microacupuncture systems. I think they changed. There was something, if I remember rightly, because I'm going back to the millennium, I think they changed something about the requirement that you couldn't do acupuncture unless, and I think it was probably an EU directive that you couldn't do it unless you were qualified either as a doctor or you qualified as a healthcare practitioner. So then someone sort of said, that's what you need to do. So that's what I did. And I was, I think throughout I've always kind of recognized the role that acupuncture, certainly in terms of chronic pain and in terms of pain management, so not just chronic pain, but also acute pain and different pain, I suppose, categories that we want to kind of split up in terms of Western medical systems. And there is a strong body of evidence behind that. And with that, there's also an opportunity. So the way I see it in terms of, what we can call Western medical approach and compared to classical Chinese medical approach is actually pain is this opportunity. It's this opportunity of actually understanding or bringing understanding between these two systems, because the models of pain and the models of pain in classical Chinese medicine, okay, the terminology is different, but they're very much aligned. And I think often we fall into a trap with Western medicine, and I'm not saying that classical Chinese medicine is isn't evidence-based. It's based on empirical observations over, hundreds of years and opinion about that. But I think in evidence-based medicine, that from a Western point of view, we fall into this trap of what I call homogeneity, is that we want to come up with, X, Y, and Z that's going to fit the majority of our patients. And I think that's where the problem we have, and that trap in understanding the role of the classical Chinese medicine in these patients, that it doesn't have that approach. It has that very much that individualized approach, and we're looking for patterns rather than the homogeneity. If we've got X, Y, and Z, we can apply it to all our patients, and most of them, the probability factor is most of them will get better.
It's fascinating, isn't it? Yeah, it's so curious to me because, look, us Westerners, we have this very strong bent toward individuality, very high, value for most of us. And yet we've created a medicine that's homogenous. You look at Asian cultures, they tend to be more homogenous and collective, generally speaking. And yet, the medicine that came out of China, now all throughout Asia, but came from China originally, fiercely, wildly individual from a culture that's more collective. I mean, if you're looking for evidence that yin-yang is a real thing, there's an example right there. So curious. And so I love the work that you're doing, because you're taking both of these sides and you're looking at, look at all these interwoven connections that are actually there.
I think that's the opportunity, definitely. I think the opportunity is to look, here's the relationship. Here's the relationship through the experience of pain patients. We're using different language, but we're talking the same thing. We're on the same page here. And I guess it's just about, and certainly from what I've done so far with my scoping review, it's about finding those things that is going to appease the evidence base, but also, I suppose, highlight and celebrate those aspects in the classical Chinese medical approach.
If it's real, it should show up in both.
Yes, and I think so far it is more about the terminology. There was a great study. I think it was done last year. I'll have to give you the details of it, but it was a study done by Coco et al. And it was looking at the idea of classical Chinese or traditional Chinese medicine as they used in their study, and Western medicine, and actually really it's more our problem, I suppose, with evidence-based medicine, that we don't acknowledge the traditional Chinese medicine approaches or the classical Chinese medicine approaches, because we're very much focused on this idea of one thing should fit everyone who has this diagnosis.
Yep. Well, you need a right hand and a left hand, just like you need a right side of the brain and a left side of the brain. So thanks for your work and bringing these things together. Any research or things that you'd like to share with us? I'll have it on the show notes page, so folks can just head over there and check that out and find you if they would like to be in touch. I've thoroughly enjoyed this walkthrough. So funny, functional pain. At the beginning, I'm like, what's functional about it? And now I have this delightful question of, I wonder what's functional about this. I think that might lead to some interesting clinical insight. So thank you so much for the conversation today.
What's really fascinating is that we try and categorize pain in different ways, which almost gives us permission to treat it in different ways and using different approaches. But actually, when we're talking about functional pain, we're talking about also, similar aspects of the multifactorial components in functional pain are also present in chronic pain, also present in acute pain. And whilst some things are effective in acute pain that are less effective in chronic pain, that are also less effective in functional pain, I think there's definitely a field of work that we can learn better approaches by looking at the role and the, I suppose, patterns that classical Chinese medicine looks for in supporting a patient in pain. I think that's probably a good way to summarize it.
Yeah, that's great. Well, thanks for all the work that you're doing, and thank you so much for your time today.
Thank you, Michael. Thanks for having me on the show.
Acupuncture is famous for treating pain, for getting rid of it. But there are situations where pain is a companion. It's not going away, and important ways a person has to learn how to live with it. We see this in the conventional medicine world with the pain management specialty, which relies primarily on medication and perhaps some PT. Our Chinese medicine world, we too have our methods. And this conversation with Jonathan reminds me of how we can work with the body, the spirit, family connections, and the myriad of relationships in the world. There may not be easy answers, but for sure, there are possibilities to explore. Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.